demonstrated, not only to ourselves, but also to the entire world, that we're capable of charting our own path towards containing the spread of this disease. We must all be proud that we have become a reference point for others on how to combat it. In all of this, I say a special aiku to our heroic healthcare workers, our efficient teams of contact tracers and testers, our far-sighted scientists, our professional security personnel, and responsible members of our media, who've done a yeoman's job over the last 11 weeks in the fight. Your efforts are truly appreciated, and the Ghanaian people will always be in your debt. When the first 2 cases were confirmed on 12th March 2020, we took timely measures to attack the virus. We decided that we would, 1, limit and stop the importation of the virus, 2, contain its spread, 3, provide adequate care for the sick, 4, limit the impact of the virus on social and economic life, and 5, use the opportunity afforded by the emergency to expand our domestic capability and deepen our self-reliance. To attain these objectives and respond to the clear evidence that large gatherings provide the most fertile grounds for the spread of the virus, on 15th March, 3 days later, under the imposition of Restrictions Act 2020 Act 1012, I placed a ban on public gatherings and closed down all schools and universities. On 21st March, I closed all our borders by land, air, and sea. Subsequently, on 27th March, I placed restrictions on movement of persons in the Greater Accra metropolitan area, Tema, Kaswa, and the Greater Kumasi metropolitan area and contiguous districts for a period of 3 weeks. In view of the obvious economic difficulties that the tough measures brought, I also announced far-reaching reliefs to ease the economic and social burden on households and businesses. These included subsidies on utilities for all, tax reliefs and financial packages for businesses, and incentives for our frontline health workers. Fellow Ghanaians, as of today, Sunday, 31st of May, under these measures, we've conducted 218,425 tests. The number of positive cases stands at 8,070. 2,947 persons have recovered. 36 have sadly died. Thirteen persons are severely ill, with 3 critically ill, for which 1 is on a ventilator, and 5,087 are responding to treatment at home, isolation centers, and hospitals. Across the country, and we've increased appreciably the number of quarantine, isolation, and treatment centers. We've lessened our dependence on foreign imports and scaled up significantly domestic production and distribution of personal protective equipment to our healthcare workers, evidence in the provision of 4,404,690 gloves, 3,524,205 nose masks, 62,094 goggles, 109,829 liters of sanitizers, 85,995 head covers, 82,615 medical scrubs, and 43,693 N95 face masks. As I've already said, everything that has been achieved so far would not have been possible without the strong cooperation of you, the Ghanaian people. I know at first hand the devastating impact the measures employed to defeat the virus has had on our social, religious, cultural, and economic lives, as well as on our jobs and the education of our children. And yet, because of love of country, we have borne with them. I know, however, that we cannot live with these restrictions forever, and that is, it is imperative we find a safe way to return our lives to normality, as other nations across the globe are trying to do. This has informed the stakeholder consultations that have occurred over the last few weeks with entities in the health, labor, religious, chieftaincy, educational, hospitality, transport, sports, tourism, and creative arts sectors. These consultations have hinged on an analysis of the data gathered and the adoption of best practices and experiences of other countries that have attempted to move on in the wake of the pandemic. A consensus has emerged from these consultations that we should embark on a strategic, controlled, progressive, safe easing of restrictions to get our lives and economy back to normal. As I stated in my May Day address a month ago, I'm now in a position to outline the roadmap for easing safely the restrictions. Ours is going to be a phased approach involving a selected list of public gatherings based on their risk profile, socio-economic impact, and most importantly, our capacity to enforce and to respond in the event of a flare-up in our number of infections. So, fellow Ghanaians, with effect from Friday, 5th June, we will begin stage 1 of the process of easing restrictions. An abridged format for religious services can commence. 25% attendance with a maximum number of 100 congregants can worship at a time in church or at the mosque, with a mandatory 1 meter rule of social distancing between congregants. In addition to the mandatory wearing of masks for all persons at all times in churches and mosques, a register of names and contact details of all worshippers and hand-washing facilities and sanitizers must be provided.